Well, good morning. I appreciate everyone joining us today. This is an important day. This is an honor, in fact, to have our guests visiting us today. It's great to have Secretary Price with us and Kellyanne Conway, the counselor to the president. It's on a critically important topic. This is about opioid abuse. And this is something that we've been passionate about addressing in Michigan for some time because it is a crisis in our country. It's terrible devastation for individuals and their families, for all of us. And we need to do more, and that's part of this effort. So I really appreciate their visit to us to have a listening session, an opportunity to learn from one another on what we can do better together, how we can partner together to help address this issue. It's great to have an opportunity to talk publicly about this. We just had a good roundtable, though, and I want to thank all our roundtable members for joining us today. I talk about their personal experiences, best practices, what we're doing here, and we want to get even better. So a number of things I would highlight. We should be proud in Michigan we have made progress, but again, take nothing for granted, not be complacent nor content. We need to stay on the gas on this issue. That basically we have a good commission structure going now based on wonderful task force work. I want to thank the Lieutenant Governor for his leadership. We have Judge Davis being a leader in this process. That's continued on. Just a month ago, we had a wonderful session, a bipartisan group of legislators standing here talking about a great package of bills, more than a dozen bills that can make a difference, and that's building on prior legislation. We'd already done good legislation on Good Samaritan laws on this topic. So we're working the legislative process, and I want to thank my legislative partners for being here today. This is about partnership. We just had Drug Take-Back Day. This is about education for the public, and we have much more to do there. In fact, it made a point that we were very successful with Drug Take-Back Day, but the numbers were staggering. Nearly 600 pounds. Think about how many pills that is. And think about how much more needs to be done, and it shouldn't be Drug Take-Back Day just one day a year. It should be every day. And I want to thank the state police for their role in making that happen and all the partnerships. So we've done a lot of good things here, but let's build on it. And let's build on it by learning from our national leaders and experts on this. And so that's where I think it's a great opportunity to have a visit like this really make a meaningful difference in this process. So I am excited today, and I'm ready to roll up my sleeves, and I can see, looking at the audience here, every one of you is ready to roll up your sleeves and redouble our efforts to work harder on this issue because our citizens deserve it, and we need to help them. So with that, let me turn it over to a great individual who's been a spokesperson on this, and unfortunately it came about through great tragedy, losing his son. But he's been a wonderful spokesperson, more than a spokesperson. He's been a great person at raising resources to help people, to actually help people in need on this topic. So with that, let me turn it over to Mike Hurst. Mike? Thank you.
Well, I really appreciate the opportunity today, and it's a great honor here. That goes without saying. You know, the governor talked about the loss of my son. Well, actually, you know, I brought him here today. And, you know, I bring this when I talk to the young kids in the schools, because this is where it all ends. Right here, these ashes in an urn. But that's the spirit and the inspiration that he provides for me on a daily basis. Now, when I bring those ashes out and I talk to these young kids, I'm going to tell you what. They're all paying attention. They're paying real close attention. They understand exactly what I'm talking about, and you know, that really hits home with them, because many of them have lost brothers, sisters, friends. It touches everyone. But I tell you what, if we can unleash the American public, if we can unleash the everyday person, the mom, the dad, the factory worker, the guy down the street, the single mom, if we can unleash that force against this horrible epidemic going on here, this horrible epidemic that it oppresses everyone that comes in contact with it. Well, I can tell you right now, in this country, we refuse to be oppressed. And if we get together on that, we work with our great officials that we have in Washington at a state level, at our local level. You know, they're all on our team, and you have to understand that. And if we can get everybody playing on the same field at the same time for a common cause, we'll defeat this, and we'll protect that entity that the American people truly hold close to their heart, and that's the right to life, liberty, and the pursuit of happiness. Thank you. I'd like to introduce Judge Linda Davis. She's a great advocate for this. Thank you.
Hi. It's a real honor to be here. As many of you know, I've been fighting this fight for almost 10 years, and will tell you that the first 4 years of that fight, I felt like I was bashing my head against the wall because no one was listening. And I oftentimes look back and think of how many young people, how many seniors, how many middle-aged people did we lose while no one was listening. And today is a real turn in this. I want to thank Lieutenant Governor Kelly and Governor Snyder for all of the great work that they've done, and for inviting Mike and I to be a part of that, because we are the passion behind the changes that need to take place. We work in a system that's broken. When I first got involved in this, I got involved because my young daughter was battling addiction, and I thought I was going to lose her, and it was the most devastating thing that ever happened in my life. But from that came a lot of good, because it born a passion in me to make sure that no other family goes through what we went through, and that things really change, and that people look at addiction as a disease, not as a moral failing. And we have a lot of work to do with that, because daily I read comments when press conferences like this are held with the misunderstanding of people that people have for addiction, and we really need to work hard to change that. And it is going to take all of us working together in every branch of our community that's touched by addiction to really turn this problem around and make a difference. I was involved with the roundtable from the President's Commission here today, and I was really pleased at what I heard. I think I asked them some really hard questions that burn on me all the time, like what are we doing to get pain management off the table? What are we doing for funding? And I want you to know, and I'm a hard person to convince that good is coming out of this, and I was pleased with what the President's people brought to the table today. And I think they're sincere about dealing with this issue. I think they're sincere about giving the states the help that we need with this issue. And together, through the federal government and our state government and our local communities, I now have restored hope that we can actually get this under control and make a real difference. And with that being said, it is really my honor to introduce to you the counselor to the President, Kellyanne Conway, to talk about the great work that they're doing. Thank you.
Judge Davis, thank you very much. I'd like to thank the others on the stage, the governor and the lieutenant governor, for your leadership on this issue. When the president traveled all across the country in the last 18 months or so, he heard story after story from family after family, and usually tales of woe and heartbreak on this issue of drug addiction and the opioid crisis. And he would take the time, keep the plane waiting, listen, look someone in the eye, and really absorb their story. So when he became the president, it's no surprise that within the first 9 or 10 weeks in office, he established, through an executive order, a commission on combating drug addiction and the opioid crisis. The head of that commission is Governor Chris Christie of New Jersey. It's a bipartisan commission tackling what we see as a nonpartisan issue with a bipartisan solution. And the more we hear from people across the country, we recognize that no state has been spared and no demographic group has remained untouched by this issue. We also like to hear the positive stories of treatment and recovery. And I'm happy to say, through the leadership of many of our statewide officials across this country, our first responders, our families, our health professionals, and those who just care and are engaged in the issue, we do tend to hear more about recovery and treatment now, which is wonderful to hear. Even though the White House and the President and the Vice President have leaned in very far on this issue and wanted to have the presidential imprimatur and engagement, we recognize that those who are closest to those in need know best what is necessary for their states and their local communities, whether it is the governors, lieutenant governors, the health professionals, certainly other members of the cabinet in each of the states, and clearly the families, the community centers, the law enforcement and first responders themselves. So we trust them to know what is best in their communities, whether it's interdiction, whether it's prevention, treatment, and recovery. We see a lot of progress and hope on this issue, all the while understanding how harrowing the statistics are. 52,000 deaths last year, according to the CDC, and a leading cause of accidental death in some states, 3 or 4 times out of car accidents, for example. So with the harrowing statistics in mind, but with a great deal of optimism and hope for the increasing numbers of stories with respect to recovery and treatment. It is my pleasure to give to you now our Secretary of Health and Human Services, only the third physician to ever hold that position in our federal government, who really has put the opioid crisis front and center of his important work at Health and Human Services, one of 3 clinical priorities he has put forth through his department. Secretary Price, thank you.
Thanks, Kellyanne, so much, and thanks to the Governor and Lieutenant Governor for allowing us to join you today, and thanks to the heartfelt stories that we've heard from individuals in the roundtable. This is exciting for me to be able to come to my home state of Michigan and to kick off what will be a series of meetings that we will have all across this country to highlight, as Kellyanne said, one of the most important challenges that we have in this nation. Bring you greetings from the President of the United States. President Trump has explained to us and told us that this has moved him in ways that he's rarely been moved. And it's because of the stories that Kellyanne mentioned that he heard on the campaign trail. The numbers are astounding. 52,000 overdose deaths last year in this nation. That's the equivalent to the number of folks that we lost as a nation in Vietnam, in the entire war, over 12 to 15 years. We're losing a Vietnam every single year in this nation. And that's unacceptable to the President, it's unacceptable to his administration, and I know it's unacceptable to every single American. And so we're putting this in focus. We are, through the Department of Health and Human Services, bringing forward a strategic plan to address this, talking about and finding out how we identify and those individuals that need the diagnosis, and then the treatment and the recovery, and highlight the recovery, to make certain we do all that we can across this nation to have overdose reversing drugs available wherever they can be. They're truly lifesavers and absolutely needed in those clinical settings. To do the work from a public health standpoint, to do the surveillance, to figure out what's going on out there. How is it that we have allowed this to get to this point, and then what do we do to turn it around? What do we do to help save those lives and make certain that others don't fall into this incredible disease of addiction? And then to do the research through the NIH and through the CDC and through SAMHSA and the other organizations that are present at the federal level to make certain that we have the kind of information that is necessary so that we can solve this challenge. And then we must not forget about the imperative of pain management in this country. As a practicing physician before I got into public service, I know the forces and the influence and the incentives that are in place for so many physicians who simply want to do the right thing, but oftentimes have the wrong incentives or the wrong influences enforced upon them. The judge mentioned pain as a fifth vital sign, one of the challenges that we've had across this nation for now over 20 years, to take something that is an important symptom for individuals who are suffering from whatever disease it may be, and to turn it into something that is used for the wrong purpose, that is to judge whether or not the care has been effective, and consequently put in place one of those perverse incentives that has led us down, in many ways, down the wrong path. So the department is absolutely committed to this. The President is absolutely committed to this. We were pleased to be able to utilize your tax dollars and put them up in a way that brought $16 million back to the state of Michigan, $485 million across the country to identify those evidence-based practices so that we can begin to turn around this scourge that knows no bounds. So it's an honor to be with you today, Governor, and folks who care so passionately about this for your fellow citizens and for our citizens all across this great land. And we look forward to partnering with each and every one of you so that we can one day have a press conference where we can say we've turned the tide on this and it's moving in the right direction. Thanks so much. Governor, turn it back to you.
Thank you.
Thank you.
And now we'll open it up from questions on topic. Rick?
For Secretary Price, could you please square your commitment on this particular issue to the proposed budget cuts by the administration to the Office of National Drug Policy?
Yeah, the ONDCP, or the Office of National Drug Policy, which most folks know as the drug czar, was started 25 or 30 years ago. Bill Bennett was the first drug czar, as folks will recall, and that's housed in the White House itself. And so the number that folks have heard about being out there in a reduction in spending for that office doesn't look at the big picture, because the big picture from a federal government standpoint is that we are increasing spending through this administration by hundreds of millions of dollars, over $700 million specifically on this issue. But through the Office of Management and Budget, OMB, and the department and the White House, we're working to make certain that those resources are in the place where they can have the greatest amount of effect, greatest influence brought to bear. The President's commitment to this is absolutely unquestionable. He understands the challenge that we have across the nation, and is committed and has told us that we will commit all the resources that we need to make certain that we turn this tide.
Other questions?
A follow-up on that, Secretary Price. As part of that White House office funds the Drug-Free Communities program, which was started by, or proposed anyways, by Senator Portman and Representative Levin from Michigan here, who have both expressed concerns that funding for that program in particular would be wiped out completely under that budget proposal. Could you comment on that?
Yeah, a couple points I would make. One is that this is a budget in process. It's a work in process, and it will go through the necessary and appropriate discussions and conversations in both the House and the Senate as they come forward with their proposal and recommendations. I'd also point out again that oftentimes what federal government does, and you all know this well, is to have multiple programs doing the same kind of thing. And so one of the roles of the Commission is to identify those redundancies and those duplicative programs that are out there, so that we can get greater efficiencies within the federal government, bring the resources to bear that are necessary to actually solve that problem. But we look forward to working with Senator Portman and others to make certain that we are not leaving any stone unturned in this great challenge.
One more?
Yeah, John.
Mr. Secretary, could you tell us a little bit more specifically where this additional $700 million will then be targeted, and will it go to some of these duplicative programs?
No. Again, that's part of the role of the commission, led under Governor Christie's leadership, and that is a work in progress as well. What the President appreciates, and what the administration appreciates, and what Senator Portman and others, Congressman Upton, who's been just a champion on this issue from the state of Michigan, is that we need to make certain that we've got the resources that can be appropriately used and effectively used at the right place at the right time. What we don't want to get trapped in is measuring the success of a federal program by how much money goes into it. We want to measure the success of a program on the outcomes. How many people are we actually helping? How many lives are we actually saving? What kinds of programs, these best practices that are here and across the country, are we utilizing those to the best degree? Are we making certain that we're paying attention to our caregivers, our providers out there, and assisting them in making the right decisions in that one-on-one clinical situation? So again, the President's commitment to this is very, very strong, and is unwavering in his desire to make certain that we turn the tide on this remarkable challenge that we have as a nation. We thank you all. Thanks.
Yeah. Well, thank you very much for coming today. We want to thank the counselor and the secretary. I want to thank the majority leader and the senators and legislators for being with us, and all the participants. This is a critically important topic. Let's keep moving forward. Thank you.
Thank you all. Thank you. Great. Thanks so much. Great job.